Section 40.13. How do DOT drug and alcohol tests relate to non-DOT tests? 40.13a. DOT tests must be completely separate from non-DOT tests in all respects. 40.13b. DOT tests must take priority and must be conducted and completed before a non-DOT test is begun. For example, you must discard any excess urine left over from a DOT test and collect a separate void for a subsequent non-DOT test. 40.13c. Except as provided in paragraph D of this section, you must not perform any tests on DOT urine or breath specimens other than those specifically authorized by this part or DOT agency regulations. For example, you may not test a DOT urine specimen for additional drugs, and a laboratory is prohibited from making a DOT urine specimen available for a DNA test or other types of specimen identity testing. 40.13d. The single exception to paragraph C of this section is when a DOT drug test collection is conducted as part of a physical examination required by DOT agency regulations. It is permissible to conduct required medical tests related to this physical examination, e.g. for glucose, on any urine remaining in the collection container after the drug test specimens have been sealed into specimen bottles. 40.13e. No one is permitted to change or disregard the results of DOT tests based on the results of non-DOT tests. For example, as an employer, you must not disregard a verified positive DOT drug test result because the employee presents a negative test result from a blood or urine specimen collected by the employee's physician or a DNA test result purporting to question the identity of the DOT specimen. 40.13f. As an employer, you must not use the CCF or the ATF in your non-DOT drug and alcohol testing programs. This prohibition includes the use of DOT forms with references to DOT programs and agencies crossed out. You also must always use the CCF and ATF for all your DOT-mandated drug and alcohol tests.